Rick, in anesthesiology, what is a difficult intubation?
Anesthesiologists are those doctors that walk in the room before the surgery and go over all the medications with you as a patient. They're in charge of getting you sedated so a surgery can occur. Intubation is where they place a device into your throat, down into the trachea, and usually, not always, intubation is endotracheal. And once they get the open area, they can pass an air tube down there so you can breathe when you're in the surgery and you're out cold. A difficult intubation is what anesthesiologists call certain protocols when a patient presents with pre-existing problems that make it difficult to get the airway open down the trachea. They call that a difficult intubation, or a DI. Now, that is a nightmare for an anesthesiologist. They know when they evaluate a patient, if it's a difficult intubation, then there's a whole bunch of protocols or decision tree, if you will, on what they should do if they have trouble getting the airway established on the patient.
If the anesthesiologist doesn't properly follow that protocol or decision tree, would that amount to a potential case for medical malpractice?
Yes, it could, Kevin, and specifically, this is not just any decision tree. There's the national group for anesthesiologists is called the American Society of Anesthesiology, or the ASA. And going back to the early 90s and continuing, they've had a written guideline for handling a difficult intubation. That's any type of patient that meets the basic appearance that it could be tough. And then there's a decision tree, and it was updated in, I believe, 2003. And it's a one-page document that's part of a study. And the anesthesiologists have studied that decision tree. And we as lawyers, of course, know it exists. And if the anesthesiologist properly follows it, there may or may not be a medical standard violation. But if they deviate completely from those protocols, there could be a claim.
Okay, thank you.
Please go to our website at hsinjurylaw.com to immediately receive by email our free report on medical malpractice claims. If you or someone you know has suffered a serious personal injury, please feel free to contact us by going to our website or calling our 1-800 number.